A very good morning, good afternoon, good evening, everyone. Welcome to our second Asia Pathogen Genomic Initiative webinar on wastewater surveillance and wastewater and environmental surveillance. Very welcome. My name is Vincent Pang. I'm assistant professor with the Duke-NUS Medical School and with Sing Health Duke-NUS Global Health Institute and the Center for Outbreak Preparedness, working on this Asia Pathogen Genomic Initiative, focusing on wastewater and environmental surveillance in Asia. We are very privileged today to have all of you to join us for this webinar. Thanks very much again. And just a quick reminder about the flow. I will run through very quickly what is Asia PGI wastewater surveillance is currently working on and our focus. And then I will actually hand over the time over to our guest speaker, Dr. Lea Necitas Apostol, to share her experience and perceptions on implementing wastewater surveillance and environmental surveillance in rural settings in Philippines. And we will really love to hear from you with regards to your comments as well as your questions, if any, for her or us in the F&Q box, which I believe should be situated in above the Zoom box that you're looking at now. It's written as Q&A, which is highlighted in background of white color. So we look forward to your questions. And for now, I will just quickly give an overview of Asia PGI wastewater and environmental surveillance. We are very thankful to Gates Foundation for supporting our key activities that we have conducted over the last 1.5 years. Next, please. So we have established an Asia Consortium for wastewater surveillance for public health, which aims to enhance regional strategic coordination and engagement in wastewater and environmental surveillance, in short, WES, expand regional technical capacities for WES, learning from polio as well as the recent COVID-19 experience, and to empower regional country partners in institutionalizations and innovations of WES. And for that purpose, we have established a WES Learning Living Dashboards that potentially help us to connect all, if not most, WES stakeholders in Asia regularly with existing and new WES activities and stakeholders, for us to have a better idea of what is happening around Asia and what are the key priorities and challenges that potentially Asia PGI can actually moderate and facilitate in terms of seeking for resources or expertise to fill up some of these gaps. And the Living Dashboard also aims to consolidate regional capacity developments, needs for training, knowledge exchange. For example, we have also established our training repository, as well as trying to establish some form of research and development prioritizations to facilitate implementation and institutionalization of WES in Asia, especially in the low and middle income countries. Next, please. So this is just a quick overview of the Living Dashboard mapping exercise that we have actively advocate for country stakeholders to provide based on these QR code. You can actually find questions that will ask questions about the characteristics of the WES that you have developed. And we definitely welcome you to contribute if you have any new activities or existing activities that is upcoming or working on WES. So these are the few gaps that we have identified through the contributions voluntarily from stakeholders so far since June last year. And we have about 73 projects and within 14 countries in Asia. Next, please. So Asia PGI is also very interested and actively working with other partners in Singapore as well as region and globally with HERA as well as our National Environmental Agency and with the support from our founder as well. We have this workshop that was conducted in June last year, and some of these workshops actually allow us to engage regional stakeholders in Asia to identify some of the gaps and to help us to facilitate our training as well as activities to fill out some of these gaps. So this is a QR code that you can actually scan and to have more insights to what had happened during the workshop itself. Next, please. So as part of the workshop, we have also organized a simple WES Innovation Hackathon, where we invited quite a number of different technology stakeholders as well as academic key stakeholders to share with us what they have innovated in terms of sample collections, data analysis, as well as data translation from informations to policies to guide policyholders. So we aim to develop this hackathon as a part of an initiative to address some of the gaps that we have identified through some of these mapping exercises through the mapping active dashboard that we have developed. Next, please. So we have also, based on the gaps identified, we have also conducted our very first WES training regional workshop in October last year. And we aim to address some of the key needs for manpower developments, especially for bioinformatics analysis and the advocacy for how to integrate multi-pathogens in the testing, as well as providing some regional guidance and to learn from the key stakeholders who are involved in WES at the moment in their respective countries to see how we can better develop a regional guidance for everyone to take reference from. And this is a QR code that you can actually have a good insight about the details that we have provided in the workshop. Next, please. And we have also contributed to our IPSN Global Partners Forum in November last year to help to address the key following gaps in terms of pathogen prioritizations. We are seeking actively, feedbacks from regional stakeholders on how we can better implement some of the prioritization tools to prioritize pathogens for member states, countries in Asia, to help them to prioritize some of the key pathogens that may be of interest, of key burden to their countries, as well as potentially may have a huge public health impact that can be implemented through wastewater surveillance. So this is another QR code that you can actually scan and have a better insight of the story that we have developed. Next, please. And last but not least, we are also very actively, involved in engaging countries and supporting our partners to strengthen national planning, institutionalizations, and budgeting for WES, as well as harmonizing sampling methods and protocols in the laboratories for testing, as well as strengthening regional guidance by learning from some of the key state countries that have already implemented WES in their respective ways. So just for example, we are supporting countries in Pakistan, Indonesia, and Cambodia at the moment, and we are hoping to have more opportunity to reach out to more countries if funding is made available. So just for information, tomorrow we are actually having another webinar focusing on ethics, legal, and risk communication in WES, organized by our partners in Pakistan, National Institute of Health, as well as AKU. So if you are interested in focusing on this topic on WES, please feel free to scan the QR code. Apologies, the QR code is maybe a bit small, but we can, do reach out to us if you're interested to find out more about this webinar. Next, please. So as we were very interested in implementing and supporting countries to sustain some of the WES and expanding the WES capabilities to multiple pathogens, we are also guiding them in terms of implementing frameworks, which is something similar to in these structures. We are advocating for the need to ask the public health actions, how are the data that they are generated or we are generating from WES is going to help in public health actions or to reduce public health burdens. What are the public health actions that can be taken? And do they have existing sewage systems that covers some of the population at risk? And I think this is particularly important when we are discussing about implementing and sustaining WES in rural settings, potentially or hugely where developed sewage system may be underdeveloped, or there may be only open or in silo sewage capabilities or systems that is available, which may potentially be a challenge for collections and sample testing on time. So we are also advocating for the need to ask about based on the pathogen prioritized, are these feasible to be detected with existing laboratory assays? if not, what are the key criteria or parameters that need to look into to facilitate, the accuracy of the testing and to better inform public health actions. And of course, last but not least, is we also advocate for the need to discuss and develop sustainability plans in terms of asking what is the most cost-effective strategy to sustain some of these testing in West, especially in the rural settings, which can be more costly than in urban settings. So there may be a need to look into the different financial models, supply chain strategies, looking at the need for developing beyond PCR approaches to TNGS approaches and the multi-pathogen approaches, and designing a more effective sampling strategies. So with this, I would like to introduce our guest speaker, Dr. Lea Necitas G, who is currently serving as Chief Science Research Specialist of the Department of Virology at the Research Institute for Tropical Medicine, the Philippines Department of Health Research. Her research interests are primarily focused on enteroviruses, including polioviruses and other vaccine-preventable viruses, diseases. She leads the National Reference Laboratory for Polio and other enteroviruses, a WHO-accredited laboratories. The ES network that she has established is now being maximized for the pilot testing of other pathogens, such as respiratory viruses, gastrointestinal viruses, arboviruses, and antimicrobial resistant pathogens. So without further ado, let's welcome Dr. Lea, please. Dr. Lea, over to you. Thank you.
Good morning, good afternoon, and good day to everyone. Duke-NUS Center for Outbreak Preparedness for inviting me and giving me the opportunity to present to you our experiences in establishing environmental surveillance here in the Philippines. Oops. So today I'm going to discuss our experience in implementing rural setting in the Philippines. And the outline of my presentation. So first, I'm going to discuss about the establishment of environmental surveillance or the wastewater based epidemiology network in the Philippines before I move to the stakeholders' roles in the establishment and the eventual implementation of WES network in the Philippines, and discuss some of the challenges that we've encountered and the challenges of building a sustainable WES in the archipelagic rural setting like the Philippines. So to understand that, is unlike other many Southeast Asian countries. So it's an archipelago composed of around 7,100 islands. You can see from the map, the right side of the slide. And we have three divisions, the Luzon, Visayas, and Mindanao. And further, in Luzon, we have 8 regions. In the Visayas, we have 3 regions. And in Mindanao, we have a big country, it's all island countries. And the population is about 106 million. Although we boast that we have a lot of languages or dialects in the Philippines, this can also be a barrier for us, at the same time a facilitator for us in establishing different surveillance programs in the Philippines. And we have different cultures from north to south and different landscape. We have mountainous areas down south and also up north, but we also have in the island sites or areas, you can see a lot of beaches. Okay, so given that we have an archipelagic setting or country, it's always a challenge for us, to establish environmental surveillance or any surveillance systems in the Philippines. One, mainly because of the geographical inaccessibility. That's why here in the Philippines, sometimes, when we do our surveillance program, we have so-called silent areas because, they are not reporting simply because they cannot, because of logistics concerns. So the second one is all about logistics. Like I said, we have far-flung areas. Sometimes it cannot be accessible, by boat. You have to go there by, plane or etc. And given that, it's a big country and we have a lot of languages, around 180 dialects. So sometimes if you go there to have a training or to have an orientation, we need to have an interpreter and to be translated all the training materials in local languages. And because we are the Pearl of the Orient, we are also prone to stakeholders, especially in establishing environmental surveillance, because it's not within the umbrella of the Department of Health, but also we need to to engage in a lot of stakeholders and recognize the very diverse social dynamics in the area in terms of political dynamics and community dynamics, because we have different cultures from north to south, and in rural archipelagic setting, sometimes it's resource unlimited. Okay, so given all of those challenges in establishing environmental surveillance or any other surveillance systems in my country, so how did we manage eventually to establish environmental surveillance program in the country? So we are anchored at the WHO initiative. It's called the Global Polio Eradication Program. And it is in this document that we anchored our WES program implementation. So it's under the objective number 1 of the polio eradication program, which is about poliovirus detection and interruption. And that includes the AFP surveillance, or the acute flaccid paralysis surveillance for human samples, and a supplemental surveillance complementary to the AFP surveillance is the environmental surveillance. So first, it's not just about, why do we need to establish environmental surveillance during that time? I think around 2015. And we did the following. So the rationale of establishing all environmental surveillance. So we did the risk assessment indicators in terms of susceptibility, the performance in the existing surveillance programs, and that's the human surveillance program for polio, and also the program or population conditions or situations. So in terms of susceptibility, so we covered, or we looked at the OPV and the IPV coverage, or vaccination coverage in the Philippines in the areas, and even the supplemental immunization or catch-up activities. And in terms of surveillance, also we look at the different performance indicators, and for the population in terms of sanitation or hygiene in the area. So in terms of susceptibility, okay, looking at the OPV coverage here, the upper right, you can see that the Philippines never actually attained the 95% vaccination coverage, both for the OPV3 at the time and also the IPV. And the IPV, we don't have any coverage because we haven't switched at the time for, way back in 2014 or in 2016, or even up to 2018 for the IPV. In terms of surveillance, for the human surveillance or the acute flaccid paralysis surveillance, okay, we have this non-polio AFP rate, and we never reached the target of 1% of 1. So we only here at 0.93. And in terms of stool adequacy, meaning to say that we submit the right specimen, good specimen, we never reached the 80% mark just before the establishment of environmental surveillance. And we don't have existing at the time environmental surveillance. In terms of the population or the community level, we have basic sanitation facilities, and there are a number of barangays declared zero open defecation is very minimal just before our implementation of environmental surveillance. So with all of this, given that we have also a history of poliovirus circulation in the country, also outbreaks of a large of CVD-PV or the vaccine-derived polioviruses. So the WHO encouraged us to actually establish a supplemental surveillance to AFP, and that is the environmental surveillance. So you can see that we are at high risk at the time for poliovirus importation just before the establishment of surveillance for our existing AFP. So in AFP, so in AFP, okay, it's still the gold standard for surveillance in the global polio eradication program. But the rationale of establishing environmental surveillance is that we know that there's this characteristic poliovirus excretion pattern. So it's being excreted in the gut, and that large numbers of excreted poliovirus remain infectious in the environment for varying lengths of time depending on the immediate conditions. And also we have available laboratory methods for the concentration and identification at the time for poliovirus in environmental sources. So we can actually, it is feasible to establish environmental surveillance at least at the time for polio. Ayan. So while in AFP, okay, or human surveillance, we look at the human excreting the poliovirus. In environmental surveillance, we directly look for the virus in the environment. So what are the strategies for implementing WES in my country? So there must be our prerequisites. So we have all these foundations, okay, that we need to have a trained staff, dedicated laboratory for WES, available equipment and laboratory supplies, and there should be a harmonized standardized protocols for testing and an institutionalized funding. So these are the prerequisites at the time before we implemented the environmental surveillance. And how did we do it? Okay, through a phase-based implementation, meaning to say the site in terms of site expansion, laboratory expansion, and pathogen test expansion. So in terms of site expansion, so we initially piloted just 2 regions, okay, before we covered all the 17 regions in the country. And also for the laboratory expansion, previously it was just centralized. So it's just one laboratory testing for environmental surveillance and for all of our surveillance programs here in the Philippines. But now, because of COVID-19 pandemic, we already expanded. So for environmental surveillance, from one centralized laboratory to 3 laboratory hubs in the Philippines. And also we have this phase-based implementation approach of for environmental surveillance regarding pathogen test expansion. Initially, it's only for polio, but now we are including other viral and bacterial pathogens. And also, we recognize that, to implement successfully the WES, or the environmental surveillance, we need to have a multi-sectoral approach in our strategy. That is because simply it's not a human surveillance, it's not under the purview, or it's not within the umbrella of the Department of Health. And so we need to meet with a lot of key stakeholders coming from the environment sector. Okay, so in multi-sectoral approach, we have to identify the key stakeholders and discuss through a consultative meetings together, and there must be a memorandum of agreement before we implement the environmental surveillance, and of course secured community commitment in that area. Okay, So with all of those strategies, okay, so from planning, consultation, engagement of the partner agencies or the key stakeholders, empowering all the stakeholders and the collectors and even the laboratory staff, and eventually we use this spectrum on how we did our environmental surveillance. So we started actually our environmental surveillance in March 2015 when we had the training in South Africa. And, after a year, we had a consultative workshop or ocular visits, okay, and the MOA signing done in March 2017, and also the training of all laboratory staff and all the collectors sometime also in March to April 2017, before we eventually. Okay, so sorry about that. Okay, so now the power is okay. So okay. Now, so we started eventually our laboratory operations in April 2017. And, thereafter we conduct an annual multi-stakeholders meeting for all our partners. Okay, and okay, so with those milestones from 2017 up to 2014, we are now, from 2 regions in just 3 major cities when we started environmental surveillance over the past years. So we have already captured all the 17 regions, in 2024, 56 out of the 88 provinces that we have in the Philippines are also covered. Okay. Okay, and in fact, just to share you, the successful implementation of environmental surveillance is that, we actually had an outbreak of polio way back in 2019 here in the Philippines amidst the COVID-19 pandemic, which is way back in 2020. So for this, the polio outbreak the poliovirus was initially or actually detected first in the environment before it's being detected in humans. So did we achieve the time for environmental surveillance, at least for the polio, our goal? And the answer is yes, because we found the virus. And in fact, we found the virus just before we found them in humans. It's very effective. Now, okay, again, sorry. Yes, I'm still here. And so with those achievements, so currently now the ES network covers the 17 regions of the country with 66 out of the 53 provinces out of 88 provinces are now covered. And in fact, because of the robust wastewater-based surveillance in my country, okay, we were designated by WHO as the Intercountry Reference Laboratory for Environmental Surveillance in the Western Pacific region, covering the Lao PDR. So all their samples, at least for the poliovirus, we do the testing, also in Cambodia and Papua New Guinea. And in fact, this year, Mongolia and Vietnam will do the environmental surveillance for, at least that's for polio. And several of the activities that we have in the pipeline are the expansion of sites to 88 provinces. So more or less around less than 20 provinces more, so that we can include all the provinces in the Philippines, and the establishment of the 2 ES concentration laboratory hubs in the Visayas and Mindanao region, or the down south, so that it's no longer centralized laboratory testing and expansion of pathogen testing. It's not just polio. And now we're covering the SARS-CoV-2 and other respiratory viruses. And for research purposes, we are now piloting AMR and, of course, avian influenza. Okay, so these are the initiatives of our environmental surveillance. It's anchored at the One Health approach, and now the newest terminology is the planetary health approach. So it's a triad of these approaches. So we covered the two. We don't cover the eco health. Okay, so for ES initiative, so we are anchoring all our approaches now at One Health and planetary health. So for One Health, it's a combination of the human and the veterinary area. And whereas for the planetary health, actually this one is it's a combination of One Health and the eco health approaches. While we still have our core laboratory surveillance systems that includes the polio and other enteroviruses, and hopefully, we could include some of the VPDs also as part of the core laboratory surveillance systems having environmental surveillance programs. Okay, so this is just to show you the framework for environmental surveillance, or the WES. So we need to have a robust or innovative laboratory-based surveillance, and that's the WES, in order for us to realize this One Health, the eco health, and the planetary health approaches in public health surveillance, and to enhance also detection capabilities, anchoring at the 717 framework, the detection, prevention framework, and response framework, to better health outcomes and attain global health security. So with all of those at the implementation level, so how did we go about it? So we need to have a criteria for the site selection. So before we go to selecting the areas, there are many coordination and consultative meetings with key stakeholders in the rural area, in the local area. And after that, after all those coordination and consultative meetings, we have to do the ocular visits and assessment of potential sites. So this is just to show you some of the criteria that we are now compiling, okay, in terms of the site selection and the types of environmental surveillance sources in both urban and rural areas for different pathogens. So when we say for VPDs, AMRs, and zoonosis, because we're now doing all of this, some are integrated in the surveillance program, like the poliovirus. But for AMR and zoonosis, it's still in the pilot testing. Okay, and for the common criteria in terms of site selection, we have noted that these are the common criteria that can be that are applicable for all of the pathogens that we are looking at now. So it's poor sanitation and in the area. So we look at the sanitation in the area. If there's a high zero open defecation, and also if there's a high prevalence of the disease in the area, and the catchment population should be ranging from 30K to 100K, and there should be an availability of courier in the area, and of course the commitment of the community, or there's this community participation. So the perceived or the felt community involvement or commitment is there when we do the ocular visits or assessment of potential sites. And several considerations also in terms of site selection. So it's for VPDs, so we noticed that there should be an evidence of household drainage, low performance in the surveillance. Definitely, when we talk about VPDs, we look at the immunization coverage in the area, so that, that could be a potential site. There should be no industrial waste, whereas for industrial waste, that can be, applicable for AMR pathogens. There should be a recent circulation of the virus, especially for the VPDs, and the availability of, and the PMOV positivity testing. So that means for VPDs, respiratory and arboviruses, so we'll look at these other considerations. Later on, I will give you what is PMMOV. So that's a pepper mild mottle virus. And for AMR pathogens, so that's with or without industrial waste, preferably near pharmaceutical companies, or fish pen or poultry, and the presence of slaughterhouses. And for zoonosis, like say for example, our pilot avian influenza, fish pen, also poultry, poultry, just poultry, and near caves for the bat surveillance. And for the types of sites, for the VPDs, at least for the polio, we take a look at the sewage treatment plants, septic treatment plants, the downstream of the rivers, but not the upstream, okay, or midstream. Whereas for the EMR pathogens and zoonosis, we look at the downstream, midstream, upstreams of the river or site. Okay, so this is just to show you the process flow of our environmental surveillance. From the field, it goes to the laboratory, and then, a feedback mechanism to, again, the field when we disseminate our results. So in terms of, the field, they do the collection, our partners there, our key stakeholders identified in the area, they're the ones collecting, storing, and transporting the specimens. So what they do, okay, we train them on the sampling method. It's grab versus composite. We have this, option, but here in the Philippines, especially in the rural area, we don't have the luxury of time to, and of course, the resources to do the composite sampling. So what we do is the grab a water sampling. And now we have the auto samplers. So we've requested these auto samplers for each of our environmental surveillance sites. Okay, so as a sampling method. And the frequency of sampling collection for our surveillance, it's monthly. And however, we shift either bi-monthly or 4 times a month, in times of outbreak or in times of pandemic, like say for example, and God forbids that another pandemic will happen, then 4 times a week or a weekly collection may be feasible also. And the temperature requirement, it should be kept, the sample should be kept at 4 to 8 degrees Celsius, and always transport in reverse cold chain. And the volume that should be submitted to laboratory is about 1 liter. So that's how we do it. And when we now receive the samples to the laboratory, okay, for the concentration method, so we do the two-phase that's for polio and other pathogens. And also we have available cafe methods. So, the source, it's here. I put it here in the slide. And we do quality control testing. That's the PMMOV testing as an IQC, which is in-house. We can also do the cross-page, which is kit-based. And we have EQUAS provided by WHO, at least for the concentration method. So we participate that on an annual basis, and we do the testing down the line in the laboratory. So what are the available concentration methods? So we do the phase, but two-phase method. So that's for polio. It could also be used for SARS-CoV-2 because we have tried this already. And the long process, but it's a long process. So it involves centrifugation, incubation overnight, and then you harvest the following day. So the process for this two-phase concentration technique is laborious. So it will take 2 days. Okay, so this concentration method, the two-phase one, is a method based on a delicate physical-chemical interactions between two carbohydrate polymers. That's our dextran T40 and the polyethylene glycol 6000 in solutions and the virus particles. So you mix them together in a solution, you leave it overnight, incubate it overnight in a refrigerator, and the following morning you will see 2 aqueous solutions. So the PEG is in the upper one, and the dextran, the hydrophilic, is in the lower one, and you collect the samples, the lower aqueous solution there. And another technique that we have in the laboratory is the cafe method. which we published together with our CDC partners. And it involves, it's based on the principle of charge-based methods where electrostatic forces are instrumental in virus filter interactions. So this is sort of like a filtration of samples using a carafe and a manifold. Okay, so this is very easy to do. However, the startup materials are very expensive. But in terms of, laboratory testing and timeliness of, doing the laboratory methods, it's very easy. So for the quality control, we do the IQC, and for the EQUAS, it's by WHO. So the PMMOV, or the pepper mild mottle virus, it's very abundant in the environment. So we use that as an internal quality control for all our testing. And for the testing, so we can do a culture, both viral and bacterial, and also we do molecular testing, the PCR, that's real-time, conventional, and digital, as well as sequencing. So we are capable of all of those, so you can do it also in your laboratory. But with all of those, harmonized protocols and resources that we have, we were struck actually during the pandemic. So the lessons learned, since we have a centralized laboratories, we felt that for the environmental surveillance at the time, they cannot submit the samples to the central laboratory. So that affected our surveillance activities. There's this difficulty in updating databases, and also definitely disruption of the routine collection of environmental samples due to infection among collectors and lockdown, etc. So as an archipelagic country, we recognize all of this experiences, and we decided to have, at least test now new alternative methodologies, and also expand the ES coverage, and at the same time expansion of laboratories in the down south. So with all our collective experiences during the concurrent polio outbreak and the COVID-19 pandemic, okay, it triggered a revision of our routine setup to address the strategies and emergent challenges. So previously, we only have a centralized laboratory. Now we're going to devolve, or we're going to at least download some of the works, like say, for example, the concentration laboratories, and at least, a laboratory by establishing in down south. So the plan now is for environmental surveillance is to seek there should be a shift in capacity building and capability upgrade by addressing the gaps, reflecting the needs of all stakeholders on whom this program depends, and rebalancing the capacity of testing from NRL level towards our regional teams, our regional stakeholders. So we plan to build surge capacity support, not just for AFP, but all the our surveillance strengthening for environmental surveillance. So we hope to, expand to all 88 provinces in the next few years, and also establishing concentration laboratories or testing laboratories in Mindanao and Visayas. Hopefully this year through our fund that we receive. It's the pandemic fund. So we have already launched the Mindanao Environmental Surveillance Concentration Laboratory, and the next for this year is in the Visayas. Okay, and also, we plan to expand the testing, not just for polio, but to other enteros. And now we are in the pilot stage of doing the AMR and the avian influenza. So with all of this works, okay, I think it's very important to recognize the role of these key stakeholders. So from planning to implementation, they should be involved. So who are the stakeholders? The environmental sector, the health sectors, especially the local government units where we do the environmental surveillance collection, etc. And of course, our laboratory network. So our stakeholders are involved in the operationalization, that means in the collection, storage, and transport of samples, and even in the testing, because now we're having the concentration labs also in the regional level. So they are important in the implementation of this downloading of concentration techniques. And also for the coordination, so we communicate with the local government units, they communicate, and private agencies regarding the collection of samples, so they do that. And in terms of response, okay, so they have to identify, environmental surveillance sites based on criteria. So they do that when we have the outbreak, especially during the time of polio outbreak. So they had that role in terms of response. And sometimes, local challenges. So they're the ones addressing those challenges in the area, and for the dissemination of results to all concerned agencies down their local government units. So what are the challenges in building a sustainable WES? Of course, still, this is about sustainability in the Philippines. It's an archipelagic country. We have the institutionalizing. It's still a problem to institutionalize funding for the environmental surveillance, or surveillance programs as a whole. And we need addressed human resource limitations, okay, by maintaining a pool of trained staff. So that's for sustainability, and recognizing that it's a multi-sectoral approach. So we need to continue engaging key stakeholders from planning to implementation of all the activities that should be done in the area, and continue to nurture the relationship through the conduct of annual meetings. So we do annual stakeholders meeting with our stakeholders for a feedback mechanism and updating. And also there should be still community ownership and commitment, because especially in terms of political support. So that's always a challenge for us, but we recognize that we need to have the political and community support to have a sustainable WES. Okay, and leverage the existing roster of frontline workers at the local level, so that there's this ownership of the program. And definitely with the challenges on community ownership, we need to establish trust at the local level. So in summary, again, how did we manage to do everything? Of course, careful planning, including risk assessment that I have presented previously, must be made, and all the prerequisites, like the foundations, like the infrastructure, the manpower, etc., must be in place before starting a WES. And recognize the importance of an inclusive, culturally sensitive, and participatory approaches in establishing WES, especially in an archipelagic country, or maybe in a big country. And we could say that successful implementation of environmental surveillance requires a phase-based, at least here in the Philippines, as an archipelagic rural setting, it's resource limited, so it should be a phase-based approach, and multi-sectoral approach. And we need to engage people in all key stakeholders. Engaging people and all key stakeholders is critically important also in the process of establishing environmental surveillance. And this environmental surveillance could be a potential, again, also a complementary tool to existing surveillance programs, and very essential for outbreak and pandemic investigation. And summary, lastly, we need to maximize the WES network here in the Philippines for the detection of other pathogens of public health importance. So we already established the importance of WES, and we could expand to other pathogen testing. So that's it for now. I would just like to have an acknowledgement with our partners listed here, the different universities and our partners for the environmental surveillance. With that, thank you very much. And yeah, sorry about the technical problems a while ago.
Thank you very much, Dr. Lea, for your very insightful and very precious sharings about your experience and highlighting the methods as well as processes as well as the challenges that you have faced and currently facing as well in sustaining and advocating for WES in rural settings in Philippines. I must say that it's really impressive if the amount of efforts that you have to go through, to see through the successful implementations of WES in the Philippines for the purpose of early detection. And I'm mindful of time. Now the time is 4:57, so we have 3 minutes to maybe address one question. I saw from the Q&A box there are about 6 questions. But out of the 6 questions, actually 2 questions were pretty much, 2 of the questions were actually focused on, how do you actually, manage to get institutionalized funding and resources to support your existing, wastewater surveillance and as well as environmental surveillance. Would you have any suggestions or any strategies that you have adopted in order to maybe even to convince stakeholders to actually contribute? Maybe just for the start for that question. Thanks.
Yeah, so how did we manage to finally institutionalize the funding for this one? Because when we started the environmental surveillance for polio, actually, the funding came from the WHO. So it's not funded by our government. And because of the outbreak, so they saw actually the importance of this environmental surveillance. And from then on, actually, we did not have this problem on having or seeking funding from the national government because of that event. So they saw the importance of WES because of the polio outbreak that happened in 2019. And because of that, it's now institutionalized and it's now embedded in our annual funding. But basically, when maybe you just have to discuss with the national key stakeholders at the national level, the importance and yeah.
Yep. Thanks very much.
Yeah.
Do you have anything else to add? Maybe just one last question, because I see more questions coming in. In terms of avian influenza, because now it's actually quite an important topic to look at. How often are you actually looking at the avian influenza based on wastewater surveillance?
So for the avian influenza, it's in the pilot stage. So we're eyeing to have like a monthly frequency of collection for that one. And yeah, we'll see over time the result of this pilot testing. So it's just, yeah.
Thanks very much. I know there are a few more other questions that we may not have the time to answer here, but I will be very happy to bring these questions to work with Dr. Lea to fill in the answers and the guidance from her, and then we can actually share through our Center for Outbreak Preparedness webpage, and also maybe to some of the email that you have used to register for this webinar to distribute to all. And I hope you really have enjoyed and learned something from the Philippine experience. And we look forward to more engagements with our colleagues from the Philippines, especially Dr. Lea, and to learn and how we can actually best support one another, to sustain and expand, like what you say, to other pathogens, including avian influenza for wastewater surveillance in Asia. To safeguard the safety and biosafety and health of our region in Asia. Thanks very much, everyone, for your contributions to the questions, and we look forward to our next webinar that we can share and learn from everyone. Thank you so much.
Thank you.
Take care. Thank you, Dr. Lea. and to the technical team that supported you for the support. Yeah, thank you.
Yes.
Thanks, everyone.